fair estimation if I said you visited her over 20 times on theatre? On what? On what, sorry, not theatre, what?
Those may be so many. Because I remember that I did a post-operative visit.
About how many?
In the first week,
Yes.
they are like maybe 3 times, but you go on tapering the visit because the patient is getting better. But I remember that, you know, I run 2 clinics at IHK. Whenever I go for my clinic, I check on the patient progress, and sometimes I have to change the dressing, that kind of one care that you give to a patient to ensure that no complication happens in the presence of the nurse and the ward doctor.
No problem. Doctor, would you document your review visits?
Yes, through the ward doctor.
What do you mean?
Yes, I give him instructions on what he should write in the chart.
Did you ever write or make any note in the patient's file throughout your claimed ward visits?
I will need to revisit that in the records.
Do you remember making any?
Myself,
Yes.
I need to revisit the records to whatever. Prove that I'm the very one who wrote, because you are usually a glove, you work, and you give instructions. Yes.
So specifically when you reviewed this file for court, you said you only reviewed things which you did, things which concern you. What did you...
When I dictate, we dictate in medicine. We dictate our notes. We dictate instructions. Because we are,
I'm not
yes.
asking you an question yet.
So I dictate. And sometimes when the medical officer is busy, you write. And for me to whatever, to prove what happened, for me the important thing that I wanted to review is what I did as an orthopedic surgeon.
Even a review of the file cannot inform you whether you made any clinical notes on review.
I am the one who managed the patient, Your Honor. I'm the one who followed up the patient as an orthopedic surgeon, and I'm telling this court the truth. And what I told the court is exactly what I did.
Of your record. So when I ask, you say you reviewed this patient several times, then you reviewed her file just a few days ago. I would be interested in knowing whether that review was capable of refreshing your mind, whether you wrote anything on any day relating to that which you say you did in the patient's file. But it's fair enough if you don't know, doctor. 2 days ago. Does it reflect you as a doctor that reviewed this accused person on ward?
Your Honor, I reviewed the patient. The police records will show you the records of the police where I used to sign and go into the room of the patient, and I manage the patient. And whatever detail I wrote, I can go and check and give you that information.
So you are not in a position to confirm whether you wrote anything?
Which day I wrote what? Because
no,
when,
I'm not about
and I'm going to tell you why I may not do it. Because those are now the minor procedures I do, because it's just dressing. It's just seeing whether the patient is swelling is getting down, and then you can tell it to the doctor. The wounds are clean, they're fine. Just remove the stitches. So
I'm just interested in a simple thing which presumably do. See a patient and put a sentence there that I've been here, the doctor is here.
When you dictated to the doctor on the board to write the notes, do you find time at the end of the day to see whether what you told them to write?
Yes, what they wrote.
So did
To ensure that they
write
the
anything?
instructions? Yes. Because this doctor was reviewed.
Whoever you were instructing to write, did they write anything in the file in
Yes.
respect of your reviews?
Yes, yeah. Review notes. The
operative record.
Very operative.
Very operative
Yes.
record of the patient.
Yes.
I want you to have it.
Let me, as I have it, let me define perioperative. Your own.
Doctor, leave that for your students, kindly. This is court.
Alright.
Okay?
So you don't want me to clear
Don't assume that we don't know. You see,
We've been asking.
we shall ask you. For now, concentrate on what we want you to
be humble
tell
and
us.
learn, but you can't learn.
Cancer is scared you will hear the truth.
But it's still running like a missile.
In fact, this form indicates you and Dr. Nen as the doctors managing that use.
Yes.
When is it dated?
Second of November.
The patient's history and examination.
This is not.
Can you read to quote what is contained in your form in respect of the patient's history and examination?
This was written by the neurosurgeon, and he wrote about his injuries.
Doctor, can you read?
Yeah. That
Please read.
deep scalp.
No,
wounds.
it doesn't begin there.
Can you start from the page?
Page 2, under patient history and examination.
Yes.
Can you read what is written?
TBI with deep cut scalp wounds following RTA, known hypertension.
What is TBI?
I don't usually use that abbreviation. That should be.
That's why my note is saying I'm not the one.
No, that's for the neurosurgeon.
Let's see.
Again, my note, that's exactly the
Why
form.
we were objecting.
And my note is the objection, that's exactly the...
Yes.
The top of that was written by Dr. Nen.
I don't want to say that it's either Dr. Nen or the anesthesiologist because I see part of dentition and usually the anesthetists are interested in that because they're going to pass. But I cannot prove that this is right. So it could be an anesthesiologist. And actually the form has very operative anesthesia record, so that should be most likely the anesthesiologist.
In the management of the client.
Your Honor, when managing a patient, from the nurses, the anesthesia team,
Can he answer to my
and
question?
the
I have not
surgeons.
asked that question, and
So,
I really
part of
request.
those-
I really request that the doctor,
Restrict yourself.
the
Yes.
doctor.
Don't worry, if there's anything that is not
this
clear,
is
you will
this
be
is
asked to
an
re-examine it.
operative anesthesia record.
And my note, the witness
Doctor
has already
is
answered. He
died.
said, I don't remember.
I don't remember
Yes.
because
He
it's
answered.
not primarily
No, he has
Where I
answered
write
that
my
I
notes.
do not remember interacting with his phone
Yes.
because of the rejected.
my interest is
Then
somewhere
another
else.
question was asked.
No, my note, I think you missed out because he defined it as a preoperative anesthesia
Record.
on page 2,
Yeah, it is
which is the record of the anesthesia's care.
it's okay. So I'm breaking it down, my lord, in simple terms. Is this supposed to be the theater record for the patient? He either knows or he doesn't.
I know that the analyst reviews the patient and writes something in the file.
But does it take
And
place in
me, what I do,
does it take place in the theater?
it can be take place on the whatever, on the ward or in emergency, depending on the situation.
And anesthesia.
Yes, they can come out and first review the patient so that they are fit to go to theatre. So it can happen anywhere before the surgery takes place. There's another form where we make operation notes, which has all the records of the pulse, the pressure, the anesthesia drugs, and everything. That's where we make the operation. At the end of that form is where we make the operation notes.
At the end of the form.
At the end of this.
Hello, the witness has denied that this is not the form where theatre notes are.
I don't write on this form.
Sorry?
I don't write on this form.
And I thought it said
That's for the anesthesia. Pre-operative assessment.
For him himself,
Yes.
doesn't write it.
And the procedure is that you should assess the patient before they go into what? To theatre. And write something. Then in theatre we have the operation notes. And we write operation notes.
And you say for you, you write on the last page, right?
Yeah, I wrote the last page.
Go to the last page. I put that the stapler is flying. The page is there.
Yeah, it's there.
Do you see your handwriting?
Yes, I see it.
What is the page number where you wrote?
It's page number 15.
Page 15.
Mm.
What is on page 14?
what you objected to.
So it is operation notes.
Okay. Confirm that this form is page numbered sequentially from page 1 to
Yes.
page 15, where you wrote.
Your Honor,
Is it or it is not?
can I answer the question?
Yes,
Yes.
is the page
Yes.
numbered?
You wrote.
Have you answered?
From page
Does
1
it go from 1, 2, 3, 4,
Up to 15, where you wrote.
up to 13, and then there's the operation notes.
Does it go from page 1 up to page 15, where you wrote? Is it numbered sequentially?
The number 14.
You don't see the number on 14?
I don't know that.
If you look at the stamp, you can see number 14 in the stamp.
You can see.
And yours is page 15.
Yeah.
Okay? Yours is 15. Right?
Yeah, it's 15. That's my handwriting.
What is the heading
It's clinical notes
of your writing?
of my writing because the form was full. My colleague had written where I'm supposed to write.
So you had a gift in it?
Yes, yes. No, what I'm saying, I'm not the one who made it. You get extra space to write your notes. Okay, because I did the operation.
My lord, which question is Dr. answering?
What is the heading? He's answering my notes
Just
question.
what the heading is.
The heading is
That
clinical
should be a
notes.
simple question.
Yeah, it's clinical notes.
And that's what it is there. Typed there.
And I think my lord, what he was clarifying is that it's typed clinical notes. Not that he wrote.
He's
My lord
not the
asked
one
whether
who wrote it.
he wrote. But the heading is typed. I think my lord was asking if he wants to.